Welcome everyone to another wonderful episode here in Jaws Podiatry. Pediatric patient presents with mom here today. Chief complaint, subungual or periungual wart. Go to wart. We haven't uploaded I think we haven't uploaded a video on a wart in quite some time. In the past I have. I'm going to go ahead and upload this one again. Something similar, just because, for the new viewers, subscribers, I think it's going to be quite important. But, as we all know, or may not know, a wart is a virus. Okay. Let's go to the whiteboard just very, very quickly. So here we have skin. Okay. And then we have this top cover here, right? We'll call it the cover. And it's usually, callus. And we can actually find these warts all over, especially weight-bearing areas. These are quite common. I would say 80% of the warts that we see on the bottom of the foot, but we can actually find them exactly, on the distal tip of the toe. I'll go ahead and show you guys. Now, what we have here is, the wart, right? That's the wart. And the wart survives blood, okay? And it loves blood. That's how it survives. So what we're going to go ahead first do today, okay? We're going to remove the callus from the top, okay? Now, there are little blood vessels inside the wart, okay? And when we get to that level, right, this level, once we remove the callus, sometimes there's a little bit of what we call pinpoint bleeding. And it's something that we see a lot. The patient usually doesn't feel anything. We just basically, once you get to that level, we cut the vessel, tiny little, areas of bleeding, but it doesn't hurt. Okay? And once we get to that level, now we're flush. Now we've hit the warty tissue. So then, what we like to use, again, for everyone out there, is something called canthrone. Let's put it up here. Canthrone. And this is actually derived, here we go, I'll try it. I don't know, this looks like, I don't know what it looks like. A beetle. It's derived from a beetle. Okay? Yes, the insect, the beetle. Animals, insects, they produce enzymes, acids, and in this particular case, the canthrone is an excellent treatment for warts. I've said it in the past, and again, every time I talk, I guess I'm pronouncing everything so much that you see how it. But I got a brand new mask. Wait till you guys see this one. Dr. Wagner, what other treatments are available? Cryotherapy, cold spray, electrocautery, surgical excision. I said it before and I'll say it again. The surgical excision, right? When doctors carve, they use the curette, they carve these things out, or they excise them. In my personal opinion, number one, extremely traumatic experience for the patient. I would say 90% of the patients that come in with warts are the younger crowd, the pediatric patients. Extremely traumatic, local anesthesia. It's a disaster. Plus, you have a secondary, at that point, once you carve it out, or excise it, you have to leave it open to let it granulate in, to fill in from the inside out. And I can name 2 or 3 other treatments, but without further ado, we're going to go ahead and, Caesar, you can show here at the tip of the toe, we have a wart. The canthrone, the acid from this beetle, is extremely powerful. How powerful? extremely. So the first thing that we're going to do is take our little 15 blade. Okay. Okay. We're going to come around here. I've already explained everything to the patient. You see? I want everyone to take a look at these little black dots. You see? All these little black dots. Let's go back to the whitey board. If you guys can what I just said, the black little dots are little, what we call pinpoint hemorrhagic changes. Okay? And I'll go very, very slow, kind of like that. I always tell the patient, if they feel anything, okay, to please tell me. Okay? So, you know, we start like that. This is the cap, right? The cap. The callus. The beginning, you know, the patient told me you've had it now for how long? 3 weeks, you said?
Like 3 weeks, yeah.
3 weeks usually equals a couple of months.
Yeah, I think it's more than
right. They just so happen to notice it. And this one, the tricky part is, I'm going to go ahead and I want you guys to see this. Are you ready? Look how it's starting to bleed.
Mm-hmm.
You see? She didn't feel anything. So I'm going to go ahead. These are quite tricky. Just because there's no one else in the office, I'm going to do something. Okay, give me 1 second. Anyone out there? Can I get a nail nipper, please? Thank you. Sorry. Okay, you see? For a second, I thought, I felt like this is the Wild West, just screaming like that. Gracias. Thank you. So what I'm going to do now is I'm going to put, stay right there, Caesar. Thank you. I'm going to go ahead and trim. Mind you, there's no pain. This is totally normal. I'm going to go ahead and trim the nail back a little bit because I know that the wart may be underneath, right? Watch out there, Mom. You okay? No pain, right? She's smiling. I know. There are cases where we have to sometimes, because you know it moves into and underneath the nail, we do remove the entire nail to get to that, right? Any pain there? Okay. I'm trying to be really, really careful here. I'm trying to go as back as I can just to make sure that we don't miss any verrucous tissue back there. Let's go to the corner here.
Is it very deep or not?
Mom is asking if it's deep.
Yeah.
Hey, we're definitely finding out as we speak. But I want to trim as much as I can first.
In comment.
Huh?
In comment, I hit you.
Yeah. Okay. Let's stop there and let's continue the debridement process. Okay. Right here. Perfect. So now we can trim a little bit on the top here. Very carefully. Patient, how are you doing? No pain, right? Mm-hmm. Okay, good. Let me know if you do start to feel a little bit. Okay? The trick is to communicate with the patient to see when you're getting to a level, and this is not a small wart by any means. This is not. Mom, it's not just a tiny little wart. Again, there's no need for anesthesia here. This is all the skin underneath the nail. A lot of callus is formed. We're carefully working the cap. It's like it's sprouted from underneath the nail. I know. It may not be so funny, right? Now on the corner here, I know. Dr. Wagner, how do you know if it's healthy skin or warty tissue. It has a rubbery feel to it. And you just know. I can feel it. That's another reason why I don't like to use a blade handle. Because I feel I have more control. You okay there?
Mm-hmm.
Anything different? Feeling a little sensitive or not? Okay, good. This is great. So when that happens, I know with certainty that we still have a little bit of more wiggle room, that we can go a little bit deeper. The deeper we go, the better it is, just because the acid will be more efficacious. Watch it bleed. See? And I'm looking up here. I'm going to still put a little bit of cantharin there. I'm going to probably just also send a little bit of this tissue to have it analyzed. Anytime I stay right there. Okay. We're almost there. Okay. Good. You're doing great. Am I?
Mm-hmm.
Okay, good. I love treating the younger population. Okay. I think that's good for today. So now we want to control the bleeding, because the blood will deactivate the Beetlejuice, the cantharin. And it will continue to bleed like a pyogenic granuloma. It bleeds and bleeds and bleeds and bleeds. Sometimes we're just gonna put a little bit of you can put a little bit of something that we call lumicaine. We'll leave this here for like 30 seconds. I'll come around here 1 second. Thank you very much. Okay, so this is lumicaine. This stops the bleeding. If there's something that we're going through a lot lately, gloves. Just because we want to make sure that anytime, you know, we touch something, someone else touches something else. This is called a foot model. So we take a little bit like this. We'll leave it open there. Caesar, open up. Okay. Let's take a look here first. So we assess, okay, so because there's a lot of bleeding, I'm gonna go ahead, stay right there. Dipstick like that. And then do this. Almost there. It's a hemostatic agent. And no, you cannot buy this stuff online if anyone is wondering. Okay. One little spot right here. You see? You've controlled the bleeding. A little bit here. A little bit here. Put a little pressure here. How you doing? Are you bored? And then just stay right there. Two little areas here that we want to it's got to be perfect. These little mighty vessels, come on, they're not cooperating. Cooperate, please. We'll put a little bit of pressure there for about 30 seconds. So now we're going to go to the last part of the procedure. We're going to take the cantharon, the Beetlejuice. You know, never say Beetlejuice, 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 because you never know what could happen. Excellent. We're almost there. And then in 2 weeks, the patient and mom will come back, and just looking at the size of the lesion, I think it may take 2 or 3 applications of the cantharon, the Beetlejuice. Sometimes I've seen a really great response. Maybe it may take more. It depends. Okay. We all set? We're all set. Good. Okay, so we're all nice and dry. The wart is this entire thing here, the whole thing. Everything. Yep. That's a great visual there. Great work. Stay right there. I'm gonna go change my gloves again. Now I'm gonna get the cantharon. The beautiful thing about cantharon is that it's a practice builder. Doesn't hurt at all. No anesthesia, no injections, no needles, and it works like a gem. I don't even know why other clinicians, other physicians, why they don't use this more. It doesn't make any sense. Colleagues that they decide they just, carve out. Doesn't make any sense at all. It's been so many years since the day that I graduated that I've never understood why. Why carve it out? Why? Put this down. Very carefully, only application of the warty tissue. If you apply it to this here, again, this cantharon does not discriminate. Whatever it's in its way, sayonara, goodbye. Take it there. There's one tiny little vessel here that we need to we'll put a little bit more. Okay, and then that's it. So here we go again, a little bit more, a little here, and that's it. Stuff is powerful. You guys smell it? It smells like an atomic bomb just went off. Really, really strong stuff. We're done.